Welcome, welcome, welcome. Good evening, everyone, and warm welcome to this special roundtable. My name is Atose Chotu, and on behalf of the board of the Black Opportunity Fund, I'd like to welcome everybody and thank everyone for taking the time to participate in this special historic event. I'd like to start us off with a brief land acknowledgement. We're meeting today on the traditional territories of many, many Indigenous people across Canada. We acknowledge their roles in taking care of these lands. I am personally meeting on the land that for thousands of years has been the traditional territories of the Seneca, the Huron-Wendat, and the Mississaugas of the Credit River. We are all grateful to live and work on this land and similar territories across Canada. As ancestors of stolen people that were brought to a stolen land, we also wish to acknowledge our Black ancestry, the history of Black peoples across the diaspora, an ancestry that recognizes the struggle to survival while honoring our narrative and pursuing self-determination. So wherever you are on Turner Island today, we continue to stand in solidarity with Indigenous peoples to dismantle the effects of colonialism and racism in all its forms. Just a little bit of housekeeping. We'd like to thank Coalius Canada, our corporate sponsors, for their generosity in putting on this event. I'd like to remind everyone that this is simultaneously translated in French, and there's an option at the bottom of your screen. You might see a globe. I'd like to remind everyone that we've encouraged open dialogue, and we have a chat, a Q&A chat, in which you can drop your questions. We may not get to all your questions, but this is just the start of the conversation, and this will definitely continue after this event. And finally, I just want to remind everyone that we're taking the opportunity to create a safe and respectful and healthy space. I also want to thank my amazing co-chair of the Black Opportunity Fund Health Working Group, Dr. Bukola Salami. We are a collaboration of individuals, healthcare providers, organizations that seek to dismantle anti-Black racism in healthcare across Canada. We recognize anti-Black racism as a barrier towards equitable healthcare access and also risk factor for healthcare outcomes in Black people and Black communities across Canada. Now, we also recognize that as little as 15% of your biology and genetics will determine your health outcome. In other words, 85% of your health outcomes are determined by your physical environment, the actions and inactions of the healthcare system, and the social and economic environment in which you live. And if we look more closely at the social terms of health, how long your heart will beat depends on where you're born, where you grow up, where you age, and where you live. And these are largely due to historical and current day economic policies, systems, social norms, political systems, social institutions such as healthcare, laws and policies in criminal justice and police services that tend to oppress Black and other racialized communities. So is no one here surprised that the COVID pandemic has disproportionately affected the Black community? And likewise, no one here should be surprised at the generational, social, mental, and physical effects of gun violence in our community. I just want to remind everyone that Black Opportunity Fund is a nonpartisan national organization, but we recognize that gun violence is a public health crisis. We want to work with groups that recognize this and understand that policy change needs to happen at all three levels. Recently, in November 2019, Toronto City Council tabled such policy, and more recently, MPP Mitzi Hunter presented her private member's bill, and I just want to give the Honorable Mitzi Hunter an opportunity to express her views.
Thank you so much, Dr. Atose. It is an honor for me to be here tonight. I feel privileged, frankly, joining the Black Opportunities Fund, your health working group roundtable on a public health approach to violence prevention, because it is such a fresh issue that is on the front burner of our communities. And the fact that you are standing up and you're taking leadership, I really applaud that. I want to thank Craig Williamson for giving me a few minutes to share about my private member's bill on gun violence. But before I do that, we just had a historic moment in the Ontario legislature where I am actually right now in my office. I have the privilege of representing the people of Scarborough-Guildwood as their MPP. I've been the MPP since 2013. And, you know, today, all parties in the legislature, so the Conservatives, the NDP, the official opposition, the Liberals, as well as the Green Party, passed a historic piece of legislation which declares the month of August in Ontario as Emancipation Month. And the reason I want to bring this to your attention, because if you read the preamble and the legislation in itself, it really embodies the aspirations of the Black community here in Ontario as in alignment with the UN Declaration of the Decade for people of African descent and diaspora, of which we are part of. And so, you know, I co-sponsored that bill, and I was very proud to see that it received royal assent today. So I just wanted to really share that with you, and I hope that you utilize it in the work that BOF is doing. Gun violence is a public health issue. It is also a social issue, and it leaves long-term impacts on our communities, and we must do more. We must do more to break the cycles of violence that is plaguing our communities. You know, when I talk to people on the front lines of this issue, they tell me that it feels like a cycle, that it just comes in waves. And right now we are in a big wave. Just today in my community in Scarborough, there was a shooting, and someone right now is in hospital being stitched up because of that. Exposure to gun violence is not just physical. There is mental and emotional and intergenerational trauma as well. And so we have to do more to really allow communities and individuals that are affected to heal and to ensure that that generational trauma is not passed on, so we break that cycle. And so, you know, my bill, which has passed first reading in the legislature, essentially it allows Ontario to recognize that gun violence is indeed a public health issue, it's a crisis, and that it must be addressed. And it does more because it will allow counseling services for survivors of gun violence to be covered by our insurance system, OHIP, and also boards of health to develop programs and services that aim to reduce gun violence and to assist those affected. So the bill is Bill 60. It is now on the books in the legislature. And what we have to do is push it forward to either get it passed or to allow the government to take up what is contained in that bill and do it now. So as Atu has said, Toronto Public Health in 2019 has made gun violence a public health issue in our city. So one of 34 public health units have done that. I'm honored to say that my initial bill, Bill 129, was referenced as part of that debate and that discussion, and the City Council approved it. Some of the objectives are already underway, such as the Sunnybrook pilot, which I know you're going to hear about tonight. But we need to do more. We need to ensure that victims of this type of violence and trauma get the help and support that they need. We have an opportunity to intervene before that bullet is fired or trafficked or pointed at one of our neighbors. And we have to do more to solve this issue at its very root. So I'm asking for your support. We have an online petition. You can find it at change.org, Stop Gun Violence, a public health crisis. Please sign that petition. When you do, you will nudge the government, the Premier, the Minister of Health, the Attorney General to get on board with this legislation. And I am encouraged. I know that I am sitting now in an opposition seat, but it is a compelling argument when we talk to the young people in our community, of which I have done. I've met with high school students, and they tell me that as young as grade 5, 6, and 7 is when the decision is made around this particular course of life. So we have to do more to intervene to break this cycle. I look to you all as leaders in our community to stand up and to help to cause this change that we so desperately need. So thank you so much for giving me this opportunity to address you tonight.
Thank you so much, or thanks to Mitzi Hunter for leading that legislation, and to all others who are working on similar policy. And Dr. Atu mentioned Toronto Public Health and declaring that a public health crisis as well. So I'm Craig Wellington, the Executive Director of Black Opportunity Fund. I'm really pleased to be here, that we're hosting and facilitating this important national discussion on this issue. And this issue is the intersection between our health task force, our education task force, and our criminal justice task force, recognizing the intersections of this issue and the very importance, as has been said, about pushing this up to an upstream intervention approach, as opposed to, the majority of the intervention is done after violence has already taken place, right? So you have people downstream in the water drowning, and everybody's figuring out how to get them out of the water. And what we want to do is go back upstream and figure out how they fell in the water in the first place, and what are the interventions that we need to do. And that's kind of the approach that we take as Black Opportunity Fund. Many of the individuals who are here today are, members of organizations doing great grassroots work, and there's many others who have done significant work in this field. And these are the very organizations that we are looking to be able to fund as we roll out our funding pockets, to look at grassroots organizations that we can help build capacity. So without further ado, it gives me great pleasure to introduce as our keynote speaker, Chief Guillermo Cespedes of the City of Oakland, California. So he is a violence prevention and intervention expert with a vast range of experience and expertise in the community level, municipal level, the national and international level. Previously, he worked in that capacity as well in Los Angeles from 2007 to 2012, where there was significant impact in terms of the programs that he put in place, in terms of looking at primary, secondary, and tertiary interventions in what he called the triangle response. And he's going to speak to that, and he's going to speak to a lot of the what are the things that work across jurisdictions and so on. So really happy to turn it over to Chief Cespedes. We're really pleased to have you here.
Thank you. It's an honor to be here. And let me start by clarifying the title. The title chief usually is endowed to law enforcement personnel. I am not law enforcement. The City of Oakland created the Department of Violence Prevention and recruited me to run it, but the community insisted that the department should be run by someone with the equal level of influence as the chief of police or the chief of the fire department. So while we don't have the same budget within the context of the City of Oakland, violence prevention is a top priority. So it's an honor to be here. My name is Guillermo Cespedes. I've been at this a very long time, a little bit over 4 decades now. And I've had the pleasure and the honor of practicing in some of the most violent cities in the world, really, both in the United States, Central America, the Eastern Caribbean, and North Africa. So what I will do today is share a little bit of lessons learned from those experiences. I always tell my colleagues that the tough part of my job is that when I was 30, I knew everything, and that's not the case anymore. So I will humbly share some of the experiences and lessons learned from the work that I've done, keeping in mind that this is a very different time than ever before. So if we go to the first slide. Okay, well, they get the PowerPoint up and running. Hello?
Yeah, sorry, just give me a second. I wasn't sure if you needed it, but I will do it.
Um, so by training, my master's is in social work. So I'm a social worker by training. I did my postgraduate work in working with families. I went to graduate school and came out of graduate school and had no idea how to help families in communities that look like me. And so it took a while to translate what I learned in graduate school to the communities that I had worked in before I went to graduate school. So I head the Department of Violence Prevention in the city of Oakland, California. It's a city of roughly 450,000 people. I'm going to be sharing lessons learned from my time as Deputy Mayor of Gang Reduction and Youth Development in Los Angeles, my work in Oakland, my work in Central America, specifically the Northern Triangle of Central America, Guatemala, Honduras, and El Salvador, the Eastern Caribbean, the English-speaking Caribbean, and North Africa, but primarily Tunisia, where we did projects there looking to prevent young men and women from the consequences of extremist groups. So let's go to the next slide. So this is the current context in the US cities. Between 2019 and 2020, the United States had a 30% spike in homicides. That equates to roughly almost 5,000 homicides, 4,900 and something homicides. That's almost 5,000 families that lost member in a year. That is the single largest one-year spike ever in recorded data on homicides. So we can say very, very clearly that no one has lived through this before because we've never had this kind of situation before. I think you're all familiar with what created that spike. And that was what I call the double pandemic or triple pandemic that we're living through. Oakland in particular had a 30% spike between 2019 and 2020. And regrettably, 2021 is ahead of the pace of 2020. So I live by data daily. And so this past weekend was the first weekend in probably 6 months that we did not have a homicide in Oakland. Homicide rate in Oakland is 2020, 25 homicides per 100,000 residents. That doesn't sound like a lot, but violence, and you know this from public health, violence doesn't concentrate evenly across cities. So there may be neighborhoods where the homicide rate is 5 times that much. So there, Deep East Oakland, you can compare the homicide rate in Deep East Oakland to countries like El Salvador, Honduras, where the homicide rate is over 100 per 100,000 residents. The issue that has come up, the context that has come up is that violence has now become, in nice terms, a race and equity issue. In more direct terms, a symbol of the structural racism that most of the communities I have worked in most of my life have lived through. This is not new. So it is not surprising that most of the cities in the neighborhoods in the United States with the largest rates of COVID infection, lowest rates of vaccines, highest rates of unemployment, et cetera, are also the cities that are have the highest rates of gun violence. In the case of Oakland, 70% of homicide victims in the last decade have been African Americans, people of African descent, 70%. And of that 70%, only 40% of those families have seen a resolution to the case. In other words, 40% do not lead to an arrest. Very different data than when we look at white victims, which have an 80% arrest rate. So where does that leave us as public health experts focusing on violence? And we were talking about upstream and downstream. We're in a moment in history where we're being called to what I say, put out fires, which means pulling the people out of the water, but simultaneously fireproofing, which means going upstream and making sure we figure out how people are falling into the water. We do not have the luxury of doing one or the other. We have to do both right now, given the pandemic that we're going through. So there are many things that I will say that could sound like contradictions. Really quickly about the department, it was formed through a council legislation in 2017. I was hired as the first chief in September 2019. I came to Oakland directly from Guyana, where I was working at the time. June 2020, we hired my deputy chief, who's an expert in gender-based violence. 2020, I inherited roughly 18 staff members that were part of another division in the city. And then in July 2021, as a recommendation from the Reimagined Public Safety Task Force, my budget was expanded by $17.4 million. It was part of the George Floyd moment, Reimagined Public Safety moment. And the funding came from closing down several police academies, which has created an issue because I think we defunded before we reimagined. But it's an honor to be in the process of reimagining and growing a department at this moment in time. Let's go to the next slide, please. So staffing budget, I just talked about funding capacity. It's an unusual department. It does funding, capacity building, administrative work, and we do direct practice. That means we're both in the field, we do administrative work, we train people, and we fund roughly 21 nonprofit organizations. My current staff is 22, my internal staff, 27 of those are direct practice, and 73% provide administrative assistance. As we expand, that formula will change. We'll grow to 34 internal staff, and 54% of those will do direct work. Budget sources, roughly $9 million from a tax ballot measure, property taxes and parking revenues. Oakland is one of the progressive cities that funds violence prevention through taxes, mainly parking taxes and property taxes. And then general fund money. This is the first year that violence prevention has received general fund dollars from the city. So that gives you an idea of the structure. We have a mandate. It's a 5-result framework, and it includes violence and trauma. Let's go to the next slide, please. So we have a mandate to reduce gun violence, to reduce intimate partner violence, to reduce sexual trafficking, to reduce the number of cold cases. We do not investigate cold cases, but I gave you the data on cold cases, so we deal with the trauma associated with cold cases. And I'm sure that if you look at cold cases or cases of resolution of homicides across most cities, you will find a disproportionate number of those are people of African descent. Public health, our public health approach is driven by the conceptual framework that it is data driven. We don't just implement anywhere. It considers community conditions. That means that we do look at violence as being created by underlying conditions, just like if you have certain underlying health conditions, you're more likely to have severe symptoms of COVID. That's the way that we look at violence. It puts community at the center, in the lead. We believe firmly that the people closest to the violence are able to lead us in building solutions to that violence. It's based on collaboration, and it includes healing from trauma. And I think all of you on this webinar know that communities of color have been carrying disproportionate level of trauma as a result of shootings, homicides, and the absence of resolution of those shootings. So it's not just that they take place, it's just that it appears that nothing happens afterwards. So let's go to the next slide, please. So as is the case with public health, we look at 3 different levels of risk or severity. One is what we call the primary level, which is the green arrow. And those are people that live in high violence communities, communities with high levels of violence, but they're not involved in the violence. Even in the worst of neighborhoods anywhere in the world, the majority of the people that live in those neighborhoods do not have their fingers on the trigger. That's the primary prevention approach that we believe is important to separate. The yellow line represents, the yellow arrow represents what we call those at risk of violence. In public health terms, that means the secondary risk level population. This may be the young men and women that are not committing serious forms of violence, but they're auditioning to become more seriously involved. They may not be involved in groups or gangs or promoting violence associated with neighborhood identity. I call them, in street terminology, the wannabes. They are the most difficult to work with because we don't see it coming. So a lot of the juvenile crime that communities and lawmakers get called about, there were many red flags before that happened. People don't go from playing checkers to shooting a gun without going through a transition. So that secondary level population, very critical. And then the blue arrow is those at the center of violence. They're referred to in public health terms as tertiary. So in terms of solutions, green line is when your doctor tells you more diet, more exercise, and more water, you'll be fine. The yellow line, the doctor may tell you better diet, but you need to take some medication. The blue line is more aggressive medical techniques. I just want to make a comment about public health, that there is misperception that public health means you talk to people about diet and exercise when they're in the middle of a heart attack. That is not the case. Public health means you approach problems through a public lens framework, but some of the interventions have to be serious. So this is the comprehensive strategy, the simplest way for me to depict it. It focuses on specific people, specific places, specific months of the year, times of the day, days of the week, and it's about behavior, not identity. This is really important. The city of LA turned itself into the gang capital of the United States, 450 gangs, for over 45,000 documented gang members by attacking the identity rather than the behavior. This reinforces identity. What I usually say kind of jokingly is that I'm a native of Cuba. I've grown up mostly outside of Cuba. But if you try to tell me not to listen to Cuban music, I start to get jittery. You know, that's a part of my identity. So we have to be very careful with that. Most of the criminal justice system has focused on identity. The war on gangs was a war on identity. Okay, so we focus on behavior, not identity. And we like to think of a comprehensive strategy where everybody in the community is at the table. But that table has 4 legs. One focuses on primary prevention, the other on secondary prevention, the other one on tertiary. And the 4th leg has to be some constitutional, relational approach to enforcement. Most of the violence being committed in these neighborhoods are committed by our children, Sometimes our children need a timeout. We want that timeout to be productive. And the way we've been giving people timeouts have made them worse. So this is sort of the principles of the comprehensive strategy. Next slide. In the case of Oakland, I will run through this very quickly. 52% of shootings with injuries come from 9 police beats throughout the city. Those are the same police beats with highest rates of COVID infection, lowest rates of vaccine. 26% of intimate partner violence calls come from those communities. And I want to make a comment about intimate partner violence because I think there is a crisis, a pandemic of gun violence throughout the country, but the piece of that is not being identified is that there's been a huge spike in intimate partner violence. And gang violence and intimate partner violence are intertwined. So while the data on intimate partner violence is lacking, the pandemic of intimate partner violence is very real. Next slide, please. This we don't need to go through. It just shows you the police beats and the data from one year to another. Police beats are not neighborhoods, but it's the best data that we can get. Next slide, please. Times of the day and days of the week. We know in the case of Oakland, 6 p.m. to midnight is where 45% of the shootings occur. Almost 46%. Therefore, we really believe that programs need to be active during the times of the day, days of the week, and times of the year where shootings spike. And that 6 p.m. to midnight is critical time. It doesn't mean that other times the violence doesn't need to be addressed, or we don't have to develop preventive programs during other times. But it is very important to recognize that we have to intervene when the problem is at its hottest, if we're going to change community norms. The myth of community youth violence. I've been in this field a long time, and I'm amazed that oftentimes violence sounds like the last name of youth. We go, youth violence. We have to stop the violence of youth. Well, most of the data across the country, this is data from Oakland, suggests that our youth are not committing the majority of violence. The average rate of a homicide victim, as well as a shooter in Oakland, is 32 years of age. So under 18 years of age, you could tell by this data that only 5% of the shootings that we have looked at in the last 4 years have been people under age 18. So this is very important as it relates to Black and brown youth, because the perception, the narrative in the media is that this is a youth problem. And that is not the case. Black and Latinos, of course, not surprisingly comprise the majority of the victims and the shooters. 51% people of African descent and 27% at those from Spanish-speaking countries. So we know who's getting killed, when they're getting killed, where they're getting killed, and when temperatures are likely to rise. Let's go to the next slide, please. So gender, I mentioned, the majority of victims are male, but in the last year in particular, we've seen something like a 300% spike in female victims showing up in emergency rooms. We have a lot of work to do around data that drives the work that protects young girls and women and grandmothers from the epidemic of violence. Next slide, please. Okay, so we're about to put out a $20 million RFQ, and I'm not going to go through every program. I'm going to go through the overall strategy. We have broken those funds into 3 buckets. One is the money that we're dedicating to gun and group related violence. In the case of Oakland, roughly 40% of violence takes place by those people that are identified with a particular group or a particular neighborhood. It does not mean that they're dealing drugs or that the identity of those individuals is group related. So we're going to dedicate roughly $10 million to eradicating the behavior of violence, both the upstream factors that create the violence as well as the downstream acts. Okay, so 10 million to that, and of course, it is also divided. If you see the green line outside, that's primary prevention. The yellow light is secondary prevention, and the blue line is tertiary. Those at the highest level of risk, the highest level of violence. By the way, I think worldwide it's something like 0.75% of the population commits. I think it's over 80% of the violence. So in every Black community, it's a very small percentage. It is not the entire community. Okay. The next bucket, next slide, is that we're dedicating $5 million to gender-based violence. Again, primary, secondary, and tertiary, specific programmings like bedside advocacy, ability for a woman to find shelter if she's being abused, pulling young men and young women off the streets that are being sex trafficked, 24/7 response to gender-based violence. That will be $5 million. And then another, next slide. The next slide is, the next bucket will be community healing and restoration. It probably should say reparations, but it's community healing and restoration, meaning that we have to dedicate sufficient funding and attention to those programs that help us process trauma. I will talk about just a few very specific approaches and dive into them, ways that we are addressing violence, or we have been addressing violence in various cities and various countries. This is all about the picture in Oakland. That's what we're doing. Next slide, please. Okay. I mentioned before differentiated levels of risk. And I believe in this not as a way of pathologizing or typecasting people, but as a way of making the point that the majority of people, and I've worked in, again, some of the most violent communities in the world, are not violent. And we need quantitative and qualitative data that is unquestionable to make that point. So I'm going to share with you a little bit of data from countries with a homicide of over 100 homicides per 100,000 residents, and data on 8 to 17-year-olds, just to kind of make that point, both about youth violence and who's committing it. So if we could go to the next slide, please. We use the risk factor framework that sounds very pathological. It measures antisocial tendencies, weak parental supervision, critical life events, impulsive risk-taking, neutralization of guilt. That means a young person that can hurt you and not feel remorse about it, negative peer influence, peer delinquency and substance abuse, and family gang influence. This is all data from risk factors from over 20 years of longitudinal studies on factors that lead young people to become part of a group. What is not here are the protective factors that keep youth out of those groups. And I will talk about that a little bit more. So we use this risk factor framework to identify those at the highest level of risk for the following reason. If community conditions were the only determinant of who becomes violent, there will be a lot more violence throughout the world. Most of the world is poor. So we have to stop criminalizing poverty and recognize that some people, some young people, have a stronger need to be a part of a group than others. So they're not gravitating towards criminality, they're gravitating towards group identity. What we want is to create positive group identity. I was only in a gang once. I called it Cuba's literacy campaign. I was 12 years old and I falsified a birth certificate so I could teach the farmers to read at age 12. There were 250,000 of us. We were a positive gang. We taught the country to read. But make no mistake, there was a lot of peer pressure to participate. And we were staunchly committed to the identity of the group. Luckily, it was a positive gang, if there is such thing. Let's go to the next slide. So why are these levels important? One, just like in medicine, the wrong intervention can make people worse. A primary level youth that you put him in a scared straight program and take him to jail so that he or she feels what it's like to be incarcerated is going to get worse. It's the equivalent of providing chemotherapy to a pimple. So primary level youth generally do better with traditional youth development programs, after school programs, piano lessons, basketball games, those kinds of things. The punitive approach, the surgery approach to someone who doesn't need it can kill them. Secondary level, and I'm not going to get to the definition of how this tool measures the risk factors, but I want to talk about the medicine a little bit more, the intervention. Secondary level requires an individualized approach. Why individualized approach? Those are youth who have more drive towards group identity. And those are the groups, if there is such thing as recruitment or audition, that are most vulnerable to become part of the group. Groups don't recruit youth in groups, they recruit them one at a time. So secondary level, individualized treatment plans, service plans, as well as for tertiary levels. What we have found is that positive family involvement critically important at a secondary and tertiary level. Think of all the activities we're doing to prevent violence where we're excluding families, or we're calling families to blame them for the problem. So we advocate a partnership with families in which we let them know that those of us professionals cannot do the work without collaborating with the people that know their children the best. Agencies don't raise children, families do. And Black and brown families have been fragmented by lots of policies that could take another webinar to go through. So we're very big on strengthening families through asset-based approaches. Next slide, please. So we've already gone through this, levels of risk should guide the medicine, just like with in medicine, and there are contraindications to over-medicating or under-medicating. I used to teach piano lessons when I did primary prevention, but I'm pretty convinced that somebody at a tertiary level, my piano lessons is not going to touch them. They need something else in addition to. So let's go to the next slide. These are some data samples from regions with homicide rates ranging from 85 to 110 per 100,000, where we did both assessments of youth ages 8 to 17, and then we work with their families. I trained roughly maybe 250 people just in Central America. None of them were clinicians, and none came from a sort of pathology-oriented approach. Okay, let's go to the next slide. So this is 11,000 youth from Honduras, the most violent communities in Honduras. The homicide rate there was actually 120 per 100,000 when I got there. And if you look at the percentage, only, and I can't see the chart very well. This slide, the smallest slice, I think it's 7%, is those at the highest level of risk. The biggest slice of the pie is primary prevention out of 11,000 youth. The gray chart, the gray part of the chart, which is 21%, is those at the secondary level. All of our emphasis in Honduras was secondary and tertiary. Primary, diet and exercise, youth development activities, anything that doesn't make them worse. Next slide, please. El Salvador, 10,000 youth. Also similar rates of homicides, over 100 per 100,000. 89% of those 10,000 youth were at a primary level. Vast majority, which makes the case for upstream prevention. Next slide, please. This is interesting because ISNA is the carceral, the juvenile detention system for El Salvador. So we went in and we did a diagnostic on 2,500 youth, and we found that even in juvenile facilities, 87% were at a primary level. We found out that it takes them about 3 months to raise their level, but when they come in, they've been arrested, they've been sentenced to a juvenile facility, but they come in psychosocially at a primary level. In the case of Honduras, El Salvador, it makes a case for why we make youth worse when we incarcerate them. The majority of the time, we're over-medicating them. In the case of the carceral system in El Salvador, 87% were at a primary level. Next slide, please. And this is the last slide on this data. This is combined from St. Lucia, St. Kitts, Nevis, and Guyana. And it's only 5,000 youth, but once again, the majority are at a primary level, very small sliver, like 3-4% are at tertiary level, and 18% so at a secondary level. So what am I trying to convey? That we have to be careful how we look at violent communities and how that translates to the people that live in it. You could live in a violent community and not be violent. This is what led to indiscriminate police tactics, going into neighborhoods, assuming that every person in the neighborhood has their fingers on the trigger. Okay, let's move forward, please. Next slide. The family, very basic approach that we developed in LA and then implemented it in Central America, in the Eastern Caribbean, in North Africa, very structured approach. Next slide. And family, I mean, whatever that looks like. Doesn't have to be mom, dad, 2 kids, a cat and a dog. It could be grandmother and uncle, whatever constitutes family for those folks. We found that it was very important in working with families to have a map, face approach. This map lasted 6 months, and every month we had different activities for the family. Why? We wanted to get away from looking at more and more problems. You could go in to help a family with the toilet and find that the roof is leaking and the carpet needs changing. And so we get overwhelmed with the problems that can be experienced by a family. But not all family problems require intervention. If they did, I think most of us grew up in problematic families and we survived them. It's just that our families had the ability to problem solve enough so that it didn't need extensive reshaping. So 6-month intervention, phases, each phase lasts a month. We look at families through 2 lenses. The vertical families, which is multi-generational, Black and brown families, and really all families before the Industrial Revolution came from extended families. I was raised by my grandmother and my grandaunt with my cousins. And so family to me is a larger tribe than just, you know, two parents and two kids. So the two parent and two kid structure, we call it horizontal. And then vertical, the multi-generational. In Oakland, the multi-generational scheme of families is referred to as the ancestrally informed family. Why is this important? Lots of research shows that the more you know about your family history and the more you have one-to-one relationships with positive members of your family, the less likely you are to be pulled into the identity of a group. So very important, if we do nothing else that does no harm, is to emphasize people knowing where they come from. Where did those recipes come from? What was the music played? Who's Aunt Hilda? How was she related to Aunt Emily? Who were your grandparents? All that information, all that storytelling that was part of our tribe, we need to recapture. That is medicine. That is public health medicine. And then the horizontal strategy is really about rebuilding rituals that your family and my family does to build cohesion. That could be going shopping together. That could be family picnics. That could be cooking together. That could be, having set time to sit at the table. That could be even having, fixed places to sit at the table. All those things that families do that have become fragmented, that's what this family systems approach was. And it had very impressive results. If we could move forward. Move forward to the next slide, please. So very basic, cartoon-like. In low-risk areas, a 13-year-old will survive the bad company, the good company, the school, because this is a 5-person family. Circles are men, women, squares are men. And a 13-year-old in a low-risk area can go through the dotted line, which represents the boundaries of the family, interact with the world, deal with all of the headaches of being a teenager, but is not likely to need more medicine than the normal teenage stuff. Next slide. In high-risk areas, what happens is that there are stronger pulls. There are strong pulls from the community that weaken the relationships inside the family. So it is not the parents cannot parent. It is not the parents are bad parents. It is that the interaction between the family and the risk in the community, when you have violence at the front door, weakens families' relationships. The pull of the family is not strong enough. It gets fragmented by the pulls of the negative energy in the community. Next slide, please. That one. So what is the process of the intervention? Strengthen the relationships inside the family, strengthen the relationships, the circles and squares outside the circle. I consider multi-generations, strengthen those relationships, strengthen the relationships with good company, strengthen the relationships with school, but do not address the bad company directly. We have found that has failed. So in high-risk communities, you run the risk of getting hurt if you're there to dismantle the gang. My teams do not arrest people. They do not have handcuffs. So how are we doing with time?
We are a bit over, but this has been
okay. So
fascinating stuff.
okay, so I will skip through the next section, which is data on reduction Will those families keep going? Keep going? Yeah. And I just want to quickly talk about reimagining and the combination, the blend of enforcement, public health, and family systems theory, which I believe was critical in the reductions in LA and is proving critical in Oakland. Let's move forward, please. The theory is this. There's a theory called relational triangles that says any relationship between two people or two entities cannot sustain sufficient stress. It fragments itself. It's inherently unstable. So we've started looking at the relationship between law enforcement and communities as a dyad that is inherently unstable. To expect that the stress is not going to fragment that relationship was not functional, was not practical for us. The same thing with city government and marginalized communities. So next slide. What does that translate into? 24 triangle incident response 24/7 in which police did not go out into the community without being accompanied by violence interrupters, social workers, CBOs. Why? To minimize, law enforcement has 3 jobs when they answer by themselves. They have to focus on investigating the crime, they have to focus on the family, and they have to focus on the associates of the family, and they have to focus on the reaction of the community. It is not possible for law enforcement to handle that. And so in LA in 2009, we started responding 24/7. Every time the police went out, my team went out to them with them. Between 2009 and 2013, we did over 2,500 responses. In Oakland, we just started that. And in the last 6 months, we've done 299. That means roughly 50 per month. What is the purpose? To reduce retaliation if it's going to take place. Group-related violence, at least 50% of group-related violence is retaliatory violence. To reduce trauma experiences by family, the quicker we wrap our arms around the family after a traumatic event, the less trauma will become embedded. And the last piece is to build relationships between city governments and marginalized communities. In the case of the communities that I've worked in, we've abandoned certain communities. We have to rebuild the trust. And part of that is by being present. So one more slide and then we could stop. The crime scene, we do the crime scene and then we go. There are 5 domains that we need to evaluate and respond. What is the impact of that shooting on the individual, the family, the peer group, the community, and the school? And every single response requires a 2-week plan to address those 5 elements. I call it crisis intervention. Last slide, which is old data, but I thought I would share it anyway, which is the close to 50% reduction that this triangle incident response was credited with. I personally don't believe it was just the triangle incident response, but I think it did have a tremendous effect. There was an evaluation done by UCLA. And anyway, the point that I'm trying to make is that as we reimagine, it may be important to redefine what the relationship between law enforcement and communities should be and not expect it to be a stable dyad. It doesn't occur in families. Dyads are unstable according to family systems theory. Let me stop there and take questions and comments. And
Yeah. Well, thank you for that, Chief Cespedes. That was brilliant. And the most, I think the key piece of it is on that data, the data-driven response. Just like with healthcare, we need to find out the causality. We need to find the root. We need to test medicines and try try different solutions. And sometimes it's about increasing the dose, it's adjusting the dose and so on. And I think that has been the approach that you've used, and the numbers speak for themselves. As you said, up to 46% decline in homicide rates, aggravated assaults by 40%. The data is there, and it has been used across a number of jurisdictions. So what we want to do, unfortunately, we are kind of tight in time. So I do want to just thank you so much for giving us this context and setting us up. And what I want to do then is now jump into and kicking off the national round table. And I'm sure the panelists here will have some idea. I know there's some connectivity in terms of some of the ideas that they have that will certainly resonate in terms of what you presented. But thank you so much.
Sure. It's okay if I stay to listen to the panel.
Absolutely. And then at the end, we will have an open Q&A and for all the panelists, including yourself. So thank you for that. So what we're going to do is we're going to turn on the microphones of the panelists, and I'm going to just introduce everybody briefly, and then we're going to go around the table, and then we're going to have like a quick everybody do a 2-minute introduction of your organization, and what you're doing, the work you're doing in this space. So first we have Paul Bailey, Executive Director of Black Health Alliance. We have Zaya Brown, founder of Think Twice International. Dunia Noor, President of African Canadian Civic Engagement Council. Michael Lewis, Case Manager for the BRAVE program, Sunnybrook Hospital. We have Derico Simmons, a co-founder of Game Changers 902 and ACC and Halifax, and Marcel Wilson, founder and president of the One by One movement. So what I'm going to do, I'm going to throw it over to you first, Paul. So great to have you here. Paul, Black Health Alliance is also a member of the Black Opportunity Fund Health Working Group. And the genesis of this several months back was Paul Bailey, Daniel Dowdy, on a call with us with Jackie Parchment, who was the head of our community outreach task force, and talking about this kind of intersectionality on this type of event to deal with the seriousness of gun and gang violence. So I wanted to turn it over to you, Paul, and talk a bit about Black Health Alliance and how you interact and work in this space, and what are your objectives and goals.
All right, thank you, Craig, and thank you, Chief Cespedes, for a really, really great presentation and enlightening. My name is Paul Bailey. I am the Executive Director of the Black Health Alliance. And my background is in urban planning and community development. I'm a strategist, really focused on how we respond to neighborhood inequality and drive health equity. The Black Health Alliance's real mission, the core of it, what we do is work to improve the health and well-being of Black communities in Canada. And we do this by working with communities to identify the challenges and the solutions as it relates to their health and well-being, working with communities to put forward a vision for the improvement of their health and well-being, and then working to mobilize the skills, tools, resources, et cetera, to make sure that communities have the resources they need to thrive. Much of our work right now focuses in the area of mental health. It focuses in the area of obviously an equitable response to the COVID pandemic. Much work over many, many years on chronic disease and chronic disease prevention. And right now we're dialing into a lot of work focused on the social determinants of health. So things like food security, things like housing, early childhood development, and responding to things like gun violence. The reason why gun violence is critical to us is we know that, as Chief Cespedes and Mitzi Hunter said, gun violence has a huge traumatic impact on communities. We know that the data suggests from other jurisdictions, we don't have the data here in Ontario, has a huge impact on things like maternal health and maternal health outcomes, mental health. And we know that when it comes to deaths, it disproportionately it impacts our community. Those are preventable excess deaths that we could challenge. And when you put those things together, Chief Cespedes talked about when you look at some of the maps, you map out some of the data, you see that low and very low income communities overlay with COVID cases, the amount of COVID cases overlay with low vaccination, overlay with things like diabetes. and overlay where we see the highest proportion of gun violence. When you put all those things together, you start to see how gun violence can have an impact on your health and well-being over your lifetime. And so we want to make sure that we're working with communities, lots of the folks on the grounds to respond to this issue and make sure that we're, not only reducing, but eliminating the issue. I'll leave it there for now. Thank you.
Thank you for that, Paul. And next up, Zaya Brown from Think Twice International. So Zaya, just kind of give us an overview of your organization and how you navigate in this space and the work that you do.
For sure. So my name is Zaya Brown. I'm the executive director of the Think Twice organization. We're a grassroots organization that focuses on gun and gang prevention and intervention. We provide supports to communities who are at risk of gun or gang involvement, are impacted by gun or gang involvement. And we also provide programming, rehabilitation supports to young people who are incarcerated and reintegrating back into the community. And lastly, we bring awareness of systemic racism and inequality within the criminal justice system. So that's pretty much what we do.
Excellent, excellent. Dunia from out west, please tell us a bit about the African Canadian Civic Engagement Council and how you navigate the layers of this issue in your jurisdiction.
Definitely. Thank you so much for having me. I'm joining you all from Treaty 6 territory, known as Edmonton, Alberta, and I'm the president of the African Canadian Civic Engagement Council. So being Black in the Prairie is very difficult because it could be very isolating. We're also the fastest growing population right now, all people of African descent that are typically immigrant or refugee experience when it comes to their migration of how they arrived in Canada. We are a thriving community. We economically contribute to the fabric of Alberta society, and there's a lot of things going on, but really and truly, we're disproportionately impacted by gun violence, including COVID-19. So the organization that I'm the president of, our mandate is to protect and promote all people of African descent's dignity and human rights, while we're also celebrating our people's contribution internationally and worldwide. Currently, we run a program that's $2.3 million that looks at supporting Black youth with economic supports. Specifically, it's the Black ecosystem, which helps them in terms of employability, being their CEO of their own company, business development, and they are supported with basic needs, which I will get into later. We're also running a program that is called the Stabilization. It's called ACB, African Caribbean Black Youth. We have 4 beds for youth that are fleeing violence or are disproportionately targeted by gangs. And we also youth that are coming out of jail. So we use that program for what we've seen in the past is a lot of our youth would be released and then like around 12 a.m. from Edmonton Remand Center or EYOC, and then they're found dead in the morning. And there's a confusion of, it's just very unfortunate in terms of even who you're releasing young people to when they're getting out of jail. We also have another program that is a court support work program that specifically focuses on gender-based violence from an intersectional lens. And also hate-motivated crimes that focuses on the intersectionality of Islamophobia, because Islamophobia and anti-Black racism and gender-based violence, it's something that, including homophobia, is something that is disproportionately impacting our young people and they're targeted. We also, last thing, we have a program that it's called, it's a court facilitation program, navigating the justice system. Right now, we are leading out west when it comes to writing the impact race and cultural assessment reports. We have youth, if you look us up, where some of our youth almost spent 11 years in jail or 5 years in jail, where we've extensively advocated for them, rehabilitated them, transitioned them into community, and they walked out without sentencing. And now they're thriving, and some of them actually bought their first houses and they're opening their businesses. When it comes to gun violence, I see it as personally, in terms of our team as a whole, we see it as lateral violence at the same time, Black on Black violence, and it's rooted in colonization, it's rooted in enslavement, it's rooted in capitalism, it's also rooted in a lot of societal illnesses. Gender-based violence when it comes to domestic violence is also disproportionately impacting all women of African descent. We have a lot of strategies. We've been having difficulties in terms of navigating the government. I feel like there's a lot of best practices we can learn from Ontario, but we can also share some of the things that are multi-layered in terms of interventions. One of the things that reduced gun violence in our city is we introduced a model that's called sacred grounds. So there's, if you just cease fire, if you're gonna fire, cease fire, you talk to elders. And it was a very humbling moment when I was in between two youth that literally were armed and they were ready to shoot each other. And I was right in between them. And how the program came is I said, in this space, you are both people of African descent. A brother does not take a brother's life away. I personally was impacted by gun violence. I lost 2 of my brothers to gun violence. I lost my baby cousin recently to gun violence. So just going in between your youth and not being afraid of your youth and not criminalizing them and just saying, look, you are hungry, you're afraid, you're alone, you are cold. Someone stepped on your white Air Force Ones. Okay, let's just pause, cease fire, let's talk about it. And if before you shoot one another, and if you want to continue shooting one another, make sure that there's no collateral, meaning that make sure that an elder is not a victim or a young person is not a victim, just meeting the youth where they're at without judgment. So we do a lot of work as well around deportation, disaggregated research, and we'll talk about all of that later. But I'm really honored to be part of this beautiful panel, seeing my people. It's a pleasure to meet you all.
Thank you so much, Janelle. President of African Canadian Civic Engagement Council, and Michael Lewis, so case manager of the BRAVE program at Sunnybrook Hospital, which is a pilot in a hospital trauma center. So that has a lot of very unique layers in that, and I'd love you to talk a bit about what you're doing, how you're modeling that approach, and you have to square a very interesting circle. Because in your program, you have to create a safe space then for people who have been injured in gang violence and so on, and build confidence. But at the same time, whenever they're coming in, of course, police are engaged if you're a victim of gang violence. So you have to kind of square a circle to build confidence in that space. So let me turn it over to you to talk about the great work that's being done there.
Oh, thank you for that wonderful introduction. I'm just humbled that I was even able to be a part of this program. It's only a year gone since the time it started. And honestly, it's been very impacted. As case manager, there's so many things that fits the role, mental health worker, job seeker, community worker, family counselor, many things that kind of fit the scope of trying to help a youth 16 to 29 who has been impacted by gun violence or by stabbing. In a sense where you meet these youths for the first time, it's a lot going on through their heads, and it shows the impact of having someone there, and not only my hospital, and I hope it spreads toward every hospital that they could look to and guide them and navigate certain things. The most important thing we focus on overall is the risk factors and the protective factors. Try to minimize the risk factors and improve the protective factors as we move forward. It's a 6-month enrolled program where you try to do as much as you can within that time. And if needed to be extension to pass on to various community organization and support services to help the youth navigate themselves into getting back on track to where they need to be. Definitely, it has been an eye-opener for myself, who has also been in many environments prior to this, in how the lack of supports, lack of services, the lack of knowledge, lack of education, and the lack of will that some of these youths have, as they feel like sometimes there's no escape. So you learn a lot about these things, and even in the Dr. Chief, when the Chief presented a lot of things, one of the most things that stuck out for me is the last, close to the last, where you had the individual, the family, the peers, and that. I think that was an in-person thing, because that's really how it works. It starts with the youth and the direction that we go in supporting everybody. But I won't take too much, but definitely it is a very impacted program. Not just me saying that, but the fact that you get to see on first hand what happens in the mind of the youth, the supports that they have, where can they go, what they lack, their strengths and weaknesses, and how to help them overcome these things one by one. I just gave you a promo one by one.
Good shout out, good shout out. So Dorico Simmons, promoted in Halifax and co-founder of the Game Changer 902 ACCE in Halifax. Dorico, and again, coming from a very different jurisdiction, and that's the interesting thing about this round table, because in each jurisdiction that we have represented, the context for, and that's why we say when we're talking about, we say Black communities and not just Black community, because you have in Halifax where you have a Black community that has been there before there was a Canada, right? So, you know, Dunia is talking about, you know, how the layers of the immigration and so on and some of that is laid on top of that. But, you know, you're out in Halifax, and I believe you're seventh generation Canadian, and still have that othering. So I'll turn it over to you to talk about the context there and the work that you're doing and so on.
Thank you. Thank you, Craig, and thank you to everyone. And as well, thank you, Chief Cespedes. So my name is Dorico Simons, 8th generation African Nova Scotian. So born and raised Halifax, Nova Scotia. And I'm speaking from the unceded, unsurrendered land of the Mi'kmaq people here. And so I also want to say, so I'm employed with the Nova Scotia government in the Office of Equity and Anti-Racism Initiatives as the executive advisor to the deputy minister. But I want to be clear that I'm not here on government business. As folks in Halifax may know me as part of that office. So I am, but I'm not here on government business. And so I've also, previous to Game Changers 902, an ACE Halifax. So that stands for Arts, Community, Culture, and Economics. 30 seconds on that is that it's a collection of young Black or young persons of African descent from across Halifax Regional Municipality. And our pillars are the name. So Arts, Community, Culture, and Economics. That's what we focus on. Previous, I was manager with municipal government of the Youth Advocate Program, Soul Strong Program, and Girls United. Those three are all community-based crime prevention programs in the city. So briefly on Game Changers 902. So GC was born out of racism and injustice that actually took place at Parliament Hill at a Black function called Black Voices on the Hill. So GC is a grassroots volunteer run organization that works to create a balanced and equitable approach in the game of life for Black people. We believe in rattling the system, rethinking approaches and reinvesting back into our communities. We believe that there has been a systemic disinvestment in our Black communities. And gun violence is important to us because we understand the impacts on community as well as its origins, and so which we work to curb. We look at really the social origins, the social inequities. And so some of the things really quickly that we've done in the past 2 years. So we provided hosted trainings, workshops for folks in community. We actually took a pretty bold stance and we called out white community in Halifax and provided particular trainings for that community to stand up and show up for our Black folks. We developed a roster of lawyers, therapists who are willing to work pro bono for our community. So if an incident happens, we get the name, we funnel it to our listserv, somebody responds, they get hooked up. We developed a formal partnership with McGinnis Cooper Law Firm. And so what that is specifically, if you're looking for legal support, you can come through us with the referral form. We'll hook you up with a lawyer. One of the popular ones is our will program, where we've seen a lot of folks in our Black communities who are passing away and may not have had their estate, their affairs in order. You can get that free through us. We also have a partnership with East Coast Lifestyle Clothing. We've created a scholarship for Black students in our community. And we host, attend, and support rallies in our province and as well in Halifax. And one big thing is we hold government and officials to account, either in meetings or public demonstrations. And last thing I'll say is that my North Star really is to create change for people today, and then as well as generations of people who are not yet born. And I believe that if we all do a little bit, then nobody has to do a lot alone.
Excellent, thank you for that. Marcel Wilson, founder and president of the One by One movement. So Marcel, please take it away. Talk a bit about your organization, how that evolved, what was the genesis, and what the work you're trying to do there.
Thank you. Hello and good evening, everyone. Firstly, I'd like to thank the Black Opportunity Fund for having me as a panelist to speak on this crucial subject matter. And thank you to the other panelists and keynote speaker for their input and work in combating this critical problem. My name is Marcel Wilson. I am a former gang member / leader and former international organized crime figure. As well known by global law enforcement agencies, during my time as a crime figure, I operated across Canada and in countries like Colombia, Panama, and Peru. Over the past decade and a half, I've managed to turn my life around while keeping my street honor intact. I'm currently the founder and president of the 1 by 1 movement, and a subject matter expert in violence prevention and intervention in gang culture and theory. 1 by 1 is a corporation comprised of a group of former gang members and leaders, former extremists, former organized crime members, to help identify, address, research, and strategize on the application of effective social programming and outreach programming for children, youth, and adults. We bring a boots on the ground, grassroots approach to things like anti-bullying, gang prevention, exiting the lifestyle plans, and long-term care through mentorship and support. We're extremely passionate about giving back, paying a debt to society inside and outside the walls of confinement, and leading others to do the same. We like to think of ourselves and refer to ourselves as ambassadors of change, AOCs. Change unprompted by the threat of punishment. The change process we've dubbed as the internal realization transformation process, the IRTP. There are many organizations that are essentially aspiring to accomplish similar goals as 1 by 1, but what makes our mission unique is our approach in challenging the standard philosophy of outreach strategies. We feel that many similar organizations have admirable goals, but some have let the people they've promised to serve slip through the cracks. We feel that this is due to an unrealistic concept that all at-risk and high-risk persons can be served or saved by a one-size-fits-all model of social intervention and services. Our goals are focused on an individual by individual, case by case, community to community approach to outreach and prevention, narrowing in on the individual community's immediate needs, demographics, religious and racial sensitivities. The 1 by 1 movement is a think tank and speakers bureau. Our primary goal as a think tank is to decrease extreme acts of violence across the globe, beginning with Canada. We've assisted organizations from the grassroots level up to government level with research, strategy, and social programming. Some of our clients, such as the Department of Justice of Canada, several divisions of the province of Ontario, and sectors of the city of Toronto, have utilized 1 by 1 movement to assist in research, strategies, development, and or tweaking existing programs utilizing our vast roster of formers. We're always seeking to have third-party evaluation through technologically heavy data collection. Our Speakers Bureau provides clients with access to all of our global members and affiliates, subject matter experts with lived experience, formers of criminal and or extreme lifestyles for speaking engagements, keynote speaking engagements, panels, and interviews. Our specifications, our target market is between 6 and 29 to no limit. We consult, assist, and implement the development of strategic planning and programming centered in prevention, intervention, reduction of recidivism, anti-bullying, negative lifestyle exit strategies, direct mentorship, development of training / workshops, advocacy, fundraising, and bringing awareness to this. Thank you for having me today.
Thank you for that. So, you know, the group that's here, there, what this is showing is that there's tremendous work being done in communities across Canada in this space, and there's many others. Obviously, we couldn't have everybody, and we wanted to make sure that we have that representation. There's others who've been working in this space forever. I want to give a shout out. I see Louis March is on here, the Zero Gun Violence Movement. I see him in the room. I want to give a shout out to the decades of work that he has done in this space. I want to throw out a question for all the panelists to talk on, take a little 2 minutes and go back around to the panel. What do you see as the biggest challenge you have to overcome to achieve meaningful change? And what's your biggest need? I'll start off with you, Paul.
So I don't know if there's one biggest challenge, right? I think it's a combination of things. I think, you know, we spoke a little bit about, as we're talking about organizing this, that this is actually a national issue, not just because it's affecting us in, you know, the various jurisdictions, but there's actually connections between Halifax and Montreal and Toronto and Calgary and Edmonton, et cetera. And I think, you know, we have to, as a community, but I think also as decision makers, look at the problem from that angle as well. The thing that's on the top of my mind, though, is lack of accountability, right? So you literally, our deaths pay enough people's mortgage, right? And so there is no impetus for real change sometimes for folks. You know, I know lots of the folks on this call, but as well our organization and you know, some of the partners that we work with have engaged deeply with, you know, elected officials and, you know, folks who work inside, for example, the city of Toronto, to try and make sure that we get the rounded out approach that, you know, Chief Cespedes talked about. I'd say that, you know, Chief Cespedes talked a little bit about an ideal situation where government, communities, et cetera, are aligned and are investing the resources needed in a way that's going to work, not just throwing money out to communities like, you know, out of the door of a helicopter, really working with communities and building authentic partnerships. I'd say, you know, two last things, that there are a number of folks, you know, on this call, but also not on the call, who need a seat at the table. And I'm not talking about grant funding, et cetera. I'm talking about really working with folks to engage, to design programs, to understand what's happening on a real time by time, community by community, updated 2021, you know, understanding about what's happening in communities. And then I think the last thing I'd say is, you know, the situation that we're faced with, I can't speak to other jurisdictions in Canada, but in Toronto, we're faced with a situation of just a sheer lack of coordination across city government, and lack of coordination across, you know, some of our community agencies. And I think, you know, whether it's accountability or whether it's the coordination, whether it's how we see and view the issue, all of these things matter for how it all comes together and how we actually deliver results on the ground. I think I'll leave it there for now. You're on mute, Craig.
See, Paul, usually you're trying to get me to shut up. Now you're trying to get me to talk. So Zia, please jump in. Same question. What do you see as the biggest challenge that you're facing? And what is your biggest need in terms of the work you're doing? Oh, you're on mute.
There are a few challenges, but I would say as a grassroots organization, we were volunteer from 2005 to 2016. And we chose not to go for funding because we didn't want anyone to dictate how we run the programs that we run. And it worked for us. As of 2016, I took it on full time and we began to seek funding. But I find that as a grassroots, there's a lack of support. Now, I know that funders have regulations that anchor agencies should work with grassroots agencies and, you know, and try to level the playing field, but that's not what happens. Grassroots basically are put into proposals and applications so that it looks good. And many times they're not supported. Many times they're looked over. And I even noticed with the city of Toronto, we'll call on everybody except for the experts that we have on the ground in our city. And the thing is that there is knowledge that we can take from everywhere, right? But we are the experts here. And I find with funders, I find with anchor agencies, they do not want to acknowledge the expertise and the knowledge that the grassroots have. Instead, they use them for funding opportunities. To me, it shows me the corruption and the disgusting, ways that the social sector has. And that has been a barrier for me. It's been a barrier for the grassroots in the city. And it's actually one of the causes for the gun violence in the city, because people are getting funding, but know absolutely nothing about the communities that they're supposed to be working with. They just write an excellent proposal and they have friends in high places. So when they get that funding, it should be going to the people that it's sent to, but it's not, right? It's going to others who have nothing to do with the grant itself and the community themselves. Or, I mean, most of the funders and EDs don't even understand the difference between a youth from a gang involved neighborhood or at-risk neighborhood versus a gang involved youth, right? There's a big difference. Most agencies don't know the difference between gun involvement, gang involved youth, gun involved youth, gang influenced youth, and gang informed youth. So at the end of the day, that's what I find is the biggest barrier for me. People will come on and say a whole bunch of whatever, but the people doing the real work are not getting those flowers, and they're not getting that support, and it's affecting the community.
Thank you for that. Thank you for that. Junior, please. Okay, same question to you. What do you find as the biggest barrier that you have to face and navigate, and what's your biggest needs in terms of doing your work?
Yeah, definitely. I was going to say that first and foremost, I'm privileged to be from a community that is resilient, and also we resist. So we resist forms of exploitation. We resist forms of pinning us against one another, because I mean, that's another issue as well. I'm also from a community that really, for the longest time, we've never depended on the system itself. And matter of fact, we've been flagged from everywhere. And just recently, when everything that we've been saying for decades came to life after the murder of our brother George Floyd, which was devastating, and all the attacks on Black Muslim women and all the youth being found dead outside, all of a sudden we're taken seriously. And we're like, but we've been saying this for a while. We come from a community that is based on social capital. So the first cases that we had, which was not the first case, but one of the first cases that we took all the way to the international courts, was around a child refugee that was getting deported, who had multiple of issues. For example, apprehended from his parents at the age of 10. Then in the child welfare system, no one applies for citizenship or PR for him, and then finds himself on the street. And then before you know, he's coping and soothing his pain with drugs and alcohol. Of course, he's vulnerable, so he becomes a drug runner by the big guys, and then he's institutionalized, he's criminalized, he's incarcerated. Now there's an undiagnosed, untreated mental health, and before you know, there's a deportation order. I personally want to thank the community of our brothers and sisters from African Nova Scotia community. You guys have been very great to us. I know that Elle Jones have been extensively working with us and supporting us, and she spent all nighters with us, and same with Brother Desmond Cole. I just want to say that Desmond Cole actually took a plane all the way from Toronto and came to Edmonton and paid for his last rent money just to help a person come out of bail. I feel like those are authentic leaderships. I appreciate people that do things like that, and it's very important. I am Somali. So we are from a community that we go through a lot of adverse traumas, and we're constantly targeted. We're heavily surveillanced. A lot of the youth that we serve directly that come to us when their backs are against the wall are youth that are from South Sudan, youth that are from Liberia, Congo, Somalia, Eritrea. We have a lot of Caribbean youth, specifically Jamaican youth, that come to us. And it just really breaks my heart when I see one shared commonality, which is displacement. And, you know, I personally will always be of the opinion that jail does not help. It does not medicate. It does not rehabilitate. And the reason why I say that is because we have our young youth that are 18 years old. They graduate from EYOC, transitioned into the adult center, and the amount of sexual violence that takes place, the lack of therapy and interventions that's put in place, the amount of people that are grooming them. You have no choice but to be violent when you're put in a situation that you're institutionalized, and you have no choice but respond violently. So it's very unfortunate, specifically Black folks that also carry multiple identities, being from the queer LGBTQ community. We just had one of our youth's older sister that's found dead inside her car, murdered. There's a lot of issues that no one is really looking at or thinking about. We need to like deprofessionalize a lot of the things. Like my sister was saying, I agree, the people that are the boots on the ground, that have the lived experience, that genuinely care, who receive the calls at 3 a.m., 2 a.m., that they themselves lost families, or they're constantly part of the cycle. I feel like that's what we should focus on. We have advocated for ourselves. Our elders actually gave us our first grants and funding, which was about $11,000, $20,000. This is a community that believes in us. Our leadership is very diverse from all over when it comes to people of African descent. And we work with the first people that we reached out to and that we've worked with is from Toronto and Halifax. And we've done a tremendous job. If you were to ask me, what is the main issue that you're facing right now? I would say that there's little to no research when it comes to mental health and people of African descent. Till now, scholars are trying to make sense of it. And I don't even think half of the things that Black folks are going through is actually in the DSM-5. One thing I could say is, I serve youth who have pre-migration trauma and post-migration trauma. We serve youth that come from the Dadaab refugee camp, that come from Kakuma refugee camp, that survived the South African apartheid, whose family were raped and tortured and mutilated in front of them. We serve young women that are in jail because they fought back and end up stabbing the person that was perpetrating and harming them and sexually trafficking and raping them. And it's very unfortunate that we still are not advocating in terms of what's happening with our youth. We have youth that are in Edmonton Remand Center in the state of psychosis episode that are literally peeing and pooing on themselves, and they're locked in the jail cell with someone else that has no mental health issues. And our question is, this person is completely disassociated from reality. Why are they in jail? Why are they not in the hospital? Of course they're going to commit crime. They're not even in touch with reality. And it's very unfortunate. So I think that when we go to the courts right now, if you look us up, the African Canadian Civic Engagement Council, the story of Edward Smith, a young boy whose life trajectory, starts from domestic violence, refugee, displacement, seeing people being hung in front of him and internalizing all of that trauma. At the age of 10 years old, he runs, and I'm sharing the story because he's an adult, and he went on CBC News and actually shared this. And we challenged the federal Minister of Justice, David Lametti. We challenged the provincial minister in Edmonton, Minister Casey Madu. And they all did come to the same conclusion, but of course, different rhetorics. That one is reconciliation and anti-racism strategy, where the conservatives are like, this is public health strategy, public safety strategy. But the purpose is, we have a youth that's 10 years old, without no shoes, runs to a police station and says, my mom is literally getting murdered by my dad. Please help me. And he's pushed and shoved out of the police station. That youth grows up, of course, where do you think he's gonna go? Where do you think he's gonna gravitate? Before you know, he's facing gun charges. Before you know, he's in jail for about, he's risking 11 years of being detained. We fought for Edward Smith and we said, not on our watch. You don't do that to our youth. And for us, we stay with our youth from the beginning all the way to the end. And all of our money comes from our elders that believe in us. All of our money comes from the young people. So the point is that in the Black community, we have a lot of PTSD, paranoia, psychosis, chronic depression, anxiety, adverse childhood trauma. And this is the real issue that no one is addressing. And they're put in a place that is mass, like we have mass policing, incarceration. Poverty matters, whether I want to acknowledge that poverty matters. And the reason why is because when you feel that there's no food on the table and you have a single immigrant mother that's working back-to-back shift and she's being abused, you will go into drug dealing. You will harm and you will be harmed. And we need to acknowledge that. And they're not bad people and they're not criminals. They're just young people that are committing crimes of poverty. And intervention, jail is not a place for them. And I think for us, just to conclude, we are going back to our ancient African spiritual practices that if you're not a whole and if you are hurting, you will naturally cause harm. And it's been a while. And so far, finally, we have the federal government responding to us. Finally, we have the city of Edmonton responding to us. But the province is still not there yet. They're still existing that. They're still trying to figure out that there's even anti-Black racism. So sorry if I get really passionate about this, but like, I feel bad. I feel like I'm dumping my trauma on you.
No, it's understandable, Dunya, and thank you for sharing that. I want to make sure that just being cognizant of the time that I get the rest of the panelists on, and of course we still have Dr. Myrna Lashley to come, and then opening it up for Q&A. So thank you for that. Let me, Michael, without further ado, let me tee you up, and please, same question. What do you find as the biggest barrier that you have to overcome? What's your greatest need in doing your work?
Honestly, other than the lack of actions and a lot of talking and a lot of mimical organizations, I have to say the accountability. After being in this sector actually working in the sector for 16 years, my first job was at a group home, young offenders group home, where I was first introduced to what it was to be incarcerated by the young people and being reintegrated in the community. From then on, I saw there was a lack of support, a lot of service, a lack of education, a lot of family meetings, and like things that would actually make the youth a better person moving forward. For them, the goal was only just to survive. And then to go out and try to make, in their eyes, they had passed in so much time that they come out and they try to make up for it so quickly. After working in all these sectors, I'm talking health, group homes, personal homes, everything. I'm at the hospital, and it's kind of the same thing, the lack of services implemented. And the organizations that are supposed to be providing these services upon any discharge are not willing to put their best foot forward. They're doing the bare minimum. And it's sad to see that you look to these people for help. You look to these people to carry on the bad, because honestly, as a player, you can't hold on to them too long, and they drop the ball all the time, consistently drop the ball. I've seen so many things in my experiences in this sector that it cries out, and you only could try to do what you can. But again, it all comes back to what are we doing? What are we representing? What's our goal? What's the objective? If it's not to make the individual a better person, then what are we doing? So all these services that get paid to do the same thing, whether it's employment, whether it's mental health, whether it's informal counseling, whether it's extracurricular activity, whether it's just a hangout spot for the kids to kind of communicate with each other. You have to understand this is not just a job. It's something that helps you build a community, not just for the individual, but for everybody that's surrounding them. Right now, I don't know if everyone's familiar with the victim services. In victim services, when a youth or individual is shot or stabbed, the compensation that they could actually get moving forward is $1,000, the most $2,000. And if you add in like groceries and maybe taxis here and there to their appointments, we're talking $3,000. So we're talking a youth that could be multiple gunshot wounds, injured in a bed, or stabbing multiple times. The only thing you could get from the government is $3,000 maximum, and that's what really ever happens. That including the doctor has to sign off on a form, which includes that this injury will last over 6 months. The problem with that is most of these injuries are mental injuries, not physical injuries at the same time. And that is something that has to be pushed, where we recognize that as well. Not just the physical damage, but the mental damage, which is really deep now. Youths are isolated after traumatic experiences, and it's hard to find supports after being discharged that are consistent with helping them come back. Because if they don't have those services provided, then they lose themselves and they fall into whatever is being supported at that time, which is mostly negative behaviors by others that are accepting them. Just as in a child will walk and go hang out with people if they're not feeling supported at home. So at the end of the day, I feel like a lot of accountability is lacking in these services, where we're not reviewing them and seeing, are we doing what is meant to be? Are we actually providing the services that are going to be beneficial for these people moving forward? Thank you.
Thanks, Michael. Thank you. Derico, same question, please.
So I want to give just a really quick context too as well. especially Craig, where you mentioned. So the community referenced in the beginning is North Preston. And so, African Nova Scotians are one of the founding people of the province of Nova Scotia after the Mi'kmaq peoples. And so we've been here for 400 plus years. And the issues that are facing Black people in Nova Scotia are steeped in racism and degradation. And we understand when in relation to policing and the justice system, that the actual origins of that were slave catchers, were night watch, were RCMP taking Indigenous children to the residential centers. I no longer call them schools, to the residential centers, and formalize into what we know today as Halifax Regional Police or RCMP. And so, when I think about any one challenge, I can't really name one. I look at this as we have systemic issues and we need systemic solutions because with governments and funders, the flavor of the day or the flavor of the year sort of changes every year. Well, it's education this year. Well, it's violence this year, et cetera, et cetera, et cetera. But we're actually not looking at the interconnectedness of all of these systems or all these issues and how they work together or against each other or compound. And so I would want to look at holistically tackling the issue. And so systemic solutions for these systemic issues. Now, if Craig, if you're pulling my leg here and I have to choose one, I would say poverty, because I actually think that poverty should be looked at as a public health crisis. And we actually have enough resources to solve the problem, but they're not equitably distributed. And so if an individual is living in poverty, your options can be limited. If you don't have the financial means to get by, if you don't have food, you're going to find it. You're going to figure it out, and that may not be to society standards the acceptable way to do it. But our people who are living this lifestyle have to survive somehow. And so if the resources are not distributed equitably, well, we've got to figure that out. And so, I think that those who have their bums in the seats are often seat warmers without the lived reality of the issues that they're actually trying to solve or that they're tasked to solve. So I believe that the urgency for change for the majority of the population will never meet the urgency of change for the minority of the population, because we have to actually live, and those folks have to live that reality every single day. So people, the decision makers, the folks who pen the checks, the funders, you don't have the same urgency because you're in a comfortable position. You don't have the same urgency to actually constitute or institute change. And really, if these issues were up to Black and Brown communities to solve, we would have done it yesterday. And so, I really think that the urgency for change at the top for the majority of the majority population is not the same as my urgency for change. So, I think that it's not radical to challenge these systems or ask these questions, especially when we're talking about gun violence. And we just had a homicide. We just had a homicide just last month, a pretty sad situation. And so, although context is different across the country, and situations may be different here in Halifax, Nova Scotia, there certainly is and has been a spike, I would say, since 2016 in relation to gun violence. In 2016, there was 9 homicides, and I think a span of 2 or 3 months in the summertime. But I'll leave it there, being mindful of time and more questions. But thanks for the question.
Thank you. And I want to be just in terms of, as I say, we're mindful of time, and I want to make sure that we get in Dr. Myrna Lashley. And I want to just ask the audience and the panelists indulgence for us to creep over a little bit in terms of time, because this is such an important discussion. I want to make sure that we do allow it a full sum. So I want to turn it over to Marcel to have the kind of the final word on the panel. Then I want to bring in Eleanor McIntosh from our education task force to kind of to give some context and bring Dr. Myrna Lashley, and then we will go into some questions. So please, Marcel.
Okay. I'll keep it short since the amazing panelists sort of touched on everything that I would say. So although there has been like an increase in public concern and funding, the current funding models and the amounts are nowhere near enough to make a meaningful change. And from what I can see, the current funding, as Ms. Brown pointed out, is not always getting to the right organizations. The organizations that are boots on the ground and that have community respect, especially amongst the at-risk and high-risk demographic, are not suitably being supported. This is, in my opinion, due to the flaws in the current funding models, as other panelists sort of touched on. Little to no evaluation on the efficacy of funded programs, and a serious lack of political will to change any of this aside from nearing election seasons. The second major problem that I see that wasn't really touched on, that needs to be addressed, is that all levels of government, organizations and agencies still operate in silos. We're always saying and hearing that this is going to take like a multilateral approach, but it never seems to ever happen in meaningful ways. The only way you can help to fix a person or people or a community is to have the people and the community at the table involved in the decision-making process and getting paid as well as or better than those who have failed this up to this point. So that's really all I have to say.
Wonderful. Well, I want to thank all the members of the panel for all the great work that you're doing, and for others who are doing also tremendous work in this space. And please stick around, and hopefully we can squeeze in a little time for some questions after. I want to turn it over to Eleanor McIntosh, who is the head of the Black Opportunity Fund Education Task Force Working Group. Please come in and provide some context and take it away, Eleanor.
Good evening, everyone. Thank you so much, Craig. And thank you very much to our keynote and panelists for their engagement this evening. It's been really, really informative and really great dialogue around how we can move forward, hopefully together as a community. My name is Eleanor McIntosh. I am an educator, administrator in the province of Ontario, and a board member of the Black Opportunity Fund. I just have a few comments that I'd like to provide before I introduce Dr. Myrna Lashley, who will close out the panel this evening before we go to Q&A. So sadly, as a high school educator in Ontario, I have observed firsthand how Black students are surveilled, questioned, ridiculed, admonished, and disciplined in ways that are both egregious and appalling. Students underserved by our system, our public education system, face really and truly diminished self-worth, poor mental wellness, and trauma as a result of their treatment and exposure to clear anti-Black racism that certainly does exist within our system. The actions and decisions by those who hold power in education leads to increased overrepresentation of cohorts of students, both male and female, in the criminal justice system for offenses that other students, specifically white students, do not get disciplined for, let alone signal any kind of police involvement. The school to prison pipeline is very much alive and well here in 2021. And we certainly have a lot of work to do around correcting and interrupting a lot of the discriminatory practices that are occurring within our system. The Black Opportunity Fund Education Task Force is a collaborative entity that actively participates in ways that we can bring current issues in education of anti-Black racism to the forefront so that we may address the issues through funding gaps and that support the BOF mandate. So with that, given the time that we have left, I'd like to take the opportunity to introduce Dr. Myrna Lashley. Myrna Lashley is an associate professor in the Department of Psychiatry at McGill University and an adjunct researcher in the Culture and Mental Health Research Unit of the Lady Davis Institute for Medical Research. At this time, please welcome Dr. Lashley.
Thank you very much for having me. I have to tell you that I would have been quite happy to forego my turn speaking and cede display space to the young people. You are inspiring. And as I get older, I sometimes wonder who's going to pick up the cudgel when I'm no longer here. I'm happy to see you. We are in good hands. Thank you for all the work you're doing. Bravo to you. Thank you very, very much for everything. You know, we're talking about violence. We're talking about gun violence. But we're not talking about the fundamental violence. Cabral said, you know, we keep shooting the bandit's shadow, but not shooting the bandit. And the bandit here is racism. And we're not talking about the violence of racism. And a lot of that violence has actually ended up in some of the gun violence that we see, and it's been alluded to here today. Racism is not victimless. It's not a victimless crime. And it is, in fact, a crime. Maybe it's not on the criminal, in the criminal books, it's not in the criminal code as such, but it is a criminal act. It harms people, it kills people, it causes people cardiovascular problems, it causes people stress, anxiety. It's certainly the basis of a lot of intergenerational trauma, which is that Black people, brown people have to tell their children how to cope with trauma. And in doing so, they re-traumatize themselves. In order, you know, your grandmother, your uncle, your dad, whoever, in order to teach us, as they taught us how to cope within a society where we're not valued, in helping us to understand why that is important and how we need to conduct ourselves, they were forced to re-traumatize themselves. And obviously also by telling us, they traumatized us. In other words, they had to harm us to help us. That's a heck of a burden to put on anybody. But this has been put on an entire community and on entire communities throughout Canada. We were told, for example, you know that the Nova Scotia Black community is an outgrowth of loyalist settlers. And we always like to talk about Canada as this great place, the end of the Underground Railway. What we don't tell people in school is that slave catchers were allowed to come here and catch people and take them back. We don't tell people that it wasn't always Canaan as it's being portrayed, that Canada is a synonym for Canaan. It wasn't always Canaan. People suffered here. It was terrible for a lot of people. Canada had segregated schools until the 1950s. I think it was 1953 when we had the last official segregated school in Canada. So we as Canadians, we've got to take our heads out of the sand and we've got to do the right thing by each other. What happens when we don't do that, and mom, dad, brother, sister, whomsoever have to deal with racism in the workplace or in the school place? We were told about what's happening in schools. I know that to be a fact. I just wrote a big report for a school board here about that. Is that we have what we refer to as displacement. People can't fight back within the workplace, or they can't fight back against the school system. So they go home and they take it out on each other. Kids get beaten up. We see high rates of addiction. We see high rates of anger displacement. Anger management is an issue. We see all of these things happening, and it's called displacement. People then take these things out on their kids or whomsoever. And of course, kids sometimes lose respect for their families because children who were born here, second generation children, they believe that they are Canadians, and in fact they are. But the compromises that their parents had to make in order for them to be here and to flourish, kids aren't going to make those. But the parents have been making those all along. Kids don't often understand, why are my parents still bombing? Why are they still behaving this way? It's because the parents have internalized that sense of inferiority, which was visited upon them. But young people don't do that. They won't do it. And why should they? They get angry. They get angry at their parents. They get angry. Parents sometimes are so overwhelmed. Someone said earlier, you work in 2 or 3 jobs. And so some of the things that you want to do to be there for your child, to help your child, you just don't have the strength. You don't have the energy. Sometimes you don't have the food. Just found out that a young person that we were working with, looks good. People keep saying he's a troublemaker. Found out that this child is hungry. This child goes to school every day without food. And we have a saying in Barbados which says, hungry belly can't learn. Now, if you are going through the formative years of adolescence, your prefrontal lobe is not, your prefrontal cortex is not fully developed. That won't get developed until you're around 25. And you're at home starving, or somebody comes and says, hey, come here, I can get you some food. A lot of the times when you see kids in something called gangs, whatever that is, they're there for safety. They're there for love. They're there for very practical, pragmatic reasons. Maybe I'm getting a meal. And we don't take that into consideration. We wait until this child gets into problems and then we call it violence. But we don't look at the violence that's happened before. There's some Indigenous researchers who are saying, stop asking what's wrong with these kids. Stop asking what's wrong with these people and ask ourselves, what's been done to them? What's happened? What have we as a society done to people so that these things are happening to them? That's the question we've got to ask. In terms of funding, you're absolutely right. The Tri-Party Council, we know that if you're going to do research with the community, you should work with the community. They should be an integral part of it. They should get funded. It should not just be academics like me being given money and then we write articles and we don't even talk to you. We ask you to fill out a form and you fill out a form for us and we use that as data. And then we get all the kudos and you get nothing. We don't even come back to you and say, let's have a focus group. Are these data correct? We just assume that we're better than. So I am one of the ones pushing against that and saying to my group, no, we cannot do that. What we're doing where I am at the hospital, we're trying to look at the education and how we're training psychiatrists and psychologists, because again, it's been mentioned, we don't have good services for people who aren't white. We really don't. Everything is funneled through the eyes of whiteness, through the lens of whiteness, just like everything has been funneled through the lens of male, of masculinity. And so we are in the process of saying, we've got to stop that. We have to look at things differently. When a child comes out of jail, and I don't believe in putting kids in jail, but when a child comes out, there should be somewhere safe for that child. So we've got to encourage people. We've got to invest in cultural humility, and we've got to invest in cultural safety. And we have to do the right thing by young people. They're our future. And if we don't do it, we're going to lose an entire generation. And we're going to, 20 years from now, we'll be right back here if we don't address the fundamental issues. And I'm telling you that racism is one of the most violent things that we face in this country. I know time is short, Craig, so I'm going to stop there because you know I can go on for a long time. But the last thing I wanted to say is that kids need hope. They don't need pathologizing. They need hope. And if we only see Black kids in February, and then the only thing we can tell them about their history is that once somebody was a slave, that's not giving anybody any hope. That's saying after all these years, all we've got is slavery. We don't tell them about people who've excelled, about our scientists, about our doctors, about our teachers, about our literary people, about our actors. We tell them, you come from slavery. And every once in a while we throw in a jazz musician. So you can either be a slave or you can play a saxophone. What hope is there for a child with that? So thank you very much for having me, Craig. Did I go over?
Oh, that was perfect. So thank you for that. As you said, it's not a violent crime is not a pathology of race as the media would let it be. Or I mean, if that was the case, then we would find fourth-year Black law students and
exactly
Black environmental engineers who are, you know, predilection to go into crime and gang violence, and that's not the case. It's not about, it's what are the social determinants of violence in the same way we look at the social determinants of health. I want to turn it over to a couple of questions, if we can take a couple of questions from the chat. We can indulge, so we'll just go in with like two. We have a question for Zaya, if she thinks there's a correlation within gun violence and incarceration, and I'll turn that over to you. And if
Yes.
there's questions, please post in the Q&A.
I'm not sure if, are you able to put up the
Yeah, I know you had a quick slide, and let's see if Michelle can just pop it up quickly.
Okay.
And just throw it. I know that was one of
So I have been talking about this a lot, and I say that there's a correlation between gun violence and incarceration because as you see with the government, they put in $75 million. If you could just turn to, just for the sake of time, just keep going to the next one. Yeah, that one's fine. That one's okay. Yeah. So the thing is that when we can't arrest our way out of the problem. So we arrest young people and we put them in prison, and there are absolutely no culturally relevant rehabilitation programming. Now, number one, there needs to be a variety of programs because there's a variety of issues, right? But there's nothing. That's one piece. So there's no culturally relevant programming. There's no culturally relevant supports that touch on grief or trauma. Now let's put that to the side for a minute. We have an issue of gun violence in the city, right? There's absolutely no programming that touches on gun or gang violence in the youth detention centers, in the provincial jails, or in the federal prisons. So those of you who know me know that we've been in the federal prison since 2009 and provide support. So we provide volunteer supports. The supports that we provide are not CSC approved. So that means when an inmate comes into our program, it is not recognized by the parole board, right? There are no programming that is CSC approved that is culturally relevant. There are very few. I think we're really the only support that's culturally relevant in the institution, and there is nothing that touches on gun or gang involvement other than myself and one other volunteer-based program. And the barriers that we face are on a different level. Even at the moment, volunteers to go into federal institutions, you need to take fingerprints on top of a clearance check, and you also have to have a credit check. So those are some of the barriers that will affect the Black community more than any other community. However, we are under barrier after barrier when it comes to corrections, and that's the problem. So you can't you can't be rehabilitated if there's no programming that's addressing the issues. And there's absolutely no programming for Black inmates that's addressing their issues, and they want it. So why I say there's a correlation between gun and gang involvement is because a lot of times the issues that you're seeing in the community are coming from jail or prison, are coming from altercations that happen in jail and prison and trickle their way out here. At the moment, there is nothing that they're doing to mitigate the gun or gang violence that's increasing. So what they do is they separate young people and they put them in different jails, different ranges, different prisons. Now, when they want to experiment, they put rivals together, and those experiments cause problems. And those experiments cause people to get hurt, and then other people deal with it when they come out into the community. So it trickles back into the community. So number one, you have nothing in place. You have experiments that are taking place in provincial and federal jails, prisons. You have the lack of programming. You have the lack of culturally sensitive programming for anything, whether it be domestic, whether it be leadership, anything on a cultural level, cultural identity. And then you have nothing that's addressing gun and gang involvement. And then on top of it, there was research that came out where the Supreme Court confirmed that CSC was biased in some of their classifications, right? So when young people are assessed and they're classified, you will see that most of the people in the maximum security prisons are Black, right? So there's bias in the classifications, and all of these things fall in line with the issues that we're seeing in the community when it comes to the government, and it trickles down into corrections and how they take away the programs, and their funding is now focused on security, right? So from 2002 to 2012, we've seen an increase in Black inmates, an 80% increase. So yeah, so I do believe young people are going in gang involved and they're coming out gang involved. They're going in not gang involved and they're coming out gang involved. So there is a direct correlation between incarceration and gun and gang violence in the city.
Thank you. Thank you for that. And that builds on some of the discussion that Chief Cespedes talked about as well. And he talked about that. So being cognizant of time, I mean, I know we could go on with this discussion. I was going to say for hours, but we could literally go on to it for weeks. I really want to thank all the panelists, Chief Cespedes, and Mitzi Hunter for the bill that you put forward, all the people, and there's many in the chat here who are doing tremendous work in this area. I want to thank Colliers for the work they've done in supporting this. And this is the first of these kind of convenings. What we wanted to do is, again, bring together a national discussion, a national roundtable where we can hear these voices. And Black Opportunity Fund, our reason that is about kind of amplifying others who are doing the work, amplifying them, allowing them to share their voice. And that's what I hope we've done today. And we hope to continue to work with organizations like those that are here. One of the things that we are committed to is in the work that we're doing is listening to, engaging with the communities that will benefit from the work that we do in terms of the support, and listen to it to make sure that we are ultimately accountable to the community in terms of what we do and provide support. So thank you all for this. Thank you everyone for being patient for this, and for everybody who shared their point of view on all the great work you do. May you all grow beautifully where you are planted, and everybody have a wonderful evening. Thank you so much.
Thank you.
Sure.
Thank you, and happy holidays to everyone.
Yes, indeed. Thank you all.
You too.
Thank you.
Oh, I see a quick question from Jackie. Did you have a quick question? Are you waving us out, Jackie? Thank you all.
So we should leave, Craig?
Yes, indeed.
Okay, bye-bye.
Good job, everybody.
Thank you
Right.
all. Bye.
Right. Craig, are we going to get a link to the webinar? So
Yes,
I'd
yes,
like to
indeed.
share it with my students also.
Yes, we will. We will get a copy of that. So look for that. And once we have it done, we will make it available and share it through our social media as well.
Thank you very much.
Thank you all.
Good evening. Good night.